Welcome to our special guests, Walid Kerry and Salwa Khoury, and welcome St. John's Norwood. And Sari, if you'd just like to say a few words.
Yeah, I just want to say thank you, John, Heidi, for organizing this. This is, and Walid and Salwa, I want you guys to know that St. John's really feels like, we really have a deep connection, a heart connection with St. Luke's. And it comes up all the time in our conversations at church, when it comes up from the pulpit. It comes up when we're talking about our budget with our vestry, our commitment to the hospital there. And it's been a real blessing for us to be able to journey along with you through the last few years, and to partner up with several projects. And I just, I hope that you hear from us today that our interest and our commitment to St. Luke's isn't just a few people. It's a church-wide thing. And so you've really affected us and you've influenced our hearts. And we're just delighted to have this opportunity to go even deeper in our relationship today.
Salwa and Walid sent us some background on them. And I felt bad that I didn't know this about you, but I'll share it with you. Dr. Kerry was born in Nablus and grew up in Nablus. He received his medical degree in 2000, and then he worked for a number of years for a pharmaceutical company. And in 2008, Archbishop Suhail Dawani appointed him as general manager of St. Luke's Hospital, which, as you probably know, has been a beacon of Christian witness and healing for more than 100 years in the West Bank. And the hospital had struggled financially, starting with the first Intifada, through the second Intifada, and the decision was made to actually close the hospital in order to restructure the entire operation. And that was a process that was led by Walid, by Dr. Kerry. It came out of that restructuring as a stable, well-respected Christian institution in Nablus. It's noted for its many of its services, but in particular its emergency and trauma center and its neurosurgery practice. Walid's a member of the Episcopal Church in Nablus. He's been a member of the Standing Committee of the Episcopal Diocese of Jerusalem since 2019. And he is currently a member of the Emergency Committee for COVID-19 response in Nablus. So welcome, Dr. Kerry. Salwa Khoury was born in Jerusalem, and she graduated from Birzeit University. After graduation, she worked at the university until she got married and moved to Nablus. She started at St. Luke's Hospital as a social worker in 1990, and then worked in the admissions department before becoming the general services director of the hospital. And then in 2008, she took on her current role of public relations director. Salwa has been with St. Luke's for 30 years. So just to begin, Walid, could you tell us just a little bit about the current conditions in Nablus and the region, what the impact of the coronavirus has been, and of course the economic downturn? What are the conditions like, and what's been the impact of the pandemic and the economic lockdown on your patients, on your families, on Nablus in general?
Okay, great. Thank you very much, John, for that flattering and gracious introduction. Thank you as well for granting St. Luke's Hospital in Nablus this forum and audience to be heard. It's greatly and humbly appreciated. Also, I'd like to go on the record as saying that I'm definitely a fan of yours, John. And as always, it's a pleasure to see you. Well, let me talk about the current conditions in Nablus, which I think are not different from conditions in any other Palestinian city. As you know, John, Nablus is a geographically large city compared to other localities. The population of Nablus is 350,000 residents. And in Nablus, to date, the total number of cases of COVID-19 infection since March 2020 is 2,095. And the total number of cases of recovered is 1,030, with 17 deaths so far in Nablus. Clearly, John, the greatest effect and consequence has been the lingering economic turmoil into which the city has been thrown. In March of this year, 90-day total closure of not only Nablus, but the entire country as an executive order from the president effectively stopped all commerce, which, as you can imagine, could not and did not remain feasible indefinitely. Consequently, public unrest due to the financial burdens this situation was beginning to cause influenced the government to open haphazardly multiple times before closing again in hopes of reducing infection. But ultimately, after 4 months, the public pressure won out, and there is what would seem a collective, calculated decision to reopen society and, most importantly, of course, the market. But in truth, would be much more akin to a false choice between life or death, as the public had no means to essentially continue. And by that, I mean buying basic essential needs, such as staple foods. And everyone was running and is still running out of money. Some industries have been permitted to reopen, others have not been so lucky. Even some of those sectors that have reopened in name are still effectively closed, because naturally there is no market if there is no cash. For example, many restaurants have closed because disposable income no longer exists. Another example is that government employees have simply not received full salaries going on 5 months, and the government sector is one of the largest. Thus, the trickle-down effect has been all-consuming. Resultingly, many families have completely exhausted their savings. The traditional structure, and here I mean the traditional Arab-Palestinian structure of extended families supporting each other, which has served our culture and society for millennia, has begun to unravel as those resources have been depleted, because so many people, virtually the entire middle class, for instance, are going bankrupt. This is the situation everywhere in Palestine, as it is the situation in Nablus, as it is the reality St. Luke's Hospital's patients and St. Luke's Hospital's patients' families have faced and are facing every day. Now, that's a fairly gloomy picture, but I'd like to think it's not all bad. There have been respites from that gloom. On one hand, even when all seems so difficult, we remember that St. Luke's is a charity hospital, and we provide a place and services for those without. And in such trying times, we feel blessed that we can provide such protection and support for those who so desperately need it in their darkest hour. Similarly, our staff is not different. They, like all Nablusites, are facing economic challenges in the aftermath of COVID-19 closures. But John, here, but with the help of a few guardian angels, St. Luke's has been able to avoid making the hard decision to limit or parse out partial salaries. In other words, as much as St. Luke's prides itself on being that lighthouse in the misty dark of night, guiding our community to the safety of the shore, we also need help. And that help came this year in the form of a generous donation right at the moment in mid-August when we were about to have to choose between essential health and safety supplies or paying full salaries. Had it not been for that perfectly timed donation, our staff of approximately 150 service providers would have had to manage a fraction of their salaries, adding to already existing financial challenges due to the closures. So thank you, American Friends of the Episcopal Diocese of Jerusalem, for that generous donation of which we were in dire need. Thank you, John.
Thank you, Walid. And it's a privilege for all of us to be able to be in a position to help. And we're delighted that all of our friends in the United States did step up and open their hearts and their wallets to help you in your time of need. So it's wonderful to hear that it really did come at just the right time for you. So have you been able to keep all your staff at the hospital and keep them on salary, or have you had to let people go?
No. We did not let anyone go till now.
That's wonderful. That's kind of amazing that you've been able to do that.
That's why I mentioned the fund in August. It was just perfect at the perfect time, Joe.
So tell us a little bit about what has changed for St. Luke's during the pandemic. What in terms of your services and what kind of procedures you've had to put in place, the kind of patients that you're seeing. What's changed for St. Luke's?
Let's say about what we had to change. Of course, we still do our job, and it's our job to help everyone. But I'll tell you an example, John, in answering this question, if you please. For example, if what's new that if a patient is infected, or if one of our staff is infected or is suspected of being infected, we have regulations and protocols now that we have to follow in order to protect the public and to protect our staff, and naturally to protect our more compromised patients, the immunocompromised patients. They may not yet be infected, but are certainly at a greater risk than others. So according to the protocols, if this happens, we have to close the hospital, sometimes for 10 days. And this is certainly not theoretical. This has already happened in at least 2 separate hospitals in the local regions. And they are still facing serious financial challenges. So we have implemented a new triage protocols regarding entry into the hospital in the first place. And these duties are carried out by a nurse and a doctor. These posts amount to 2 full-time, meaning 24 hours, 7 days a week paid positions that we had not previously factored into our budget, George.
Well, Lida, I want to come back to the hospital and ask Salwa a couple of questions about the hospital. But before we do that, can you just tell us a little bit about how the West Bank's Palestinians' general mood and outlook? Are people hopeful? Are they pessimistic? Are they resigned? With all that's going on with the Abraham Accords, the signing of a peace agreement between Israel and Arab states, the economic downturn. What's the feeling of Palestinians in the West Bank right now?
Okay, that certainly sounds like an interesting question, of course, but I'd have to draw attention to its being an overtly political one, John. And in general, my response to most political questions is the same, and it's simple. We receive support from organizations like American Friends of the Diocese, which is a humanitarian charitable organization. There is no doubt that like American Friends, all humanitarian organizations operates in politically problematic regions, conflict zones, areas in which there are many actors, some at odds with each other, some at odds even with your own political views, but within those localities are people, humans, who need assistance, who need humanitarian aid. Therefore, the overwhelming superordinate goal of providing aid to those who are in need rules the day. My work is similar, John. Our work is no different. At the end of the day, in spite of whichever direction any number of political problematic issues and decisions go, at the end of the day, no matter who or which party happens to sit in the throne or congressional chair, my charge never changes. Our responsibilities revolve around providing treatment, aid, ministry, charity, and a wide variety of services to the members of our local community who need it. Now, to be clear, John, that may sound like my sidestepping the question, so I will offer a direct response. Those whose work is to hold their ears to the street and report the atmosphere and politics are certainly still doing their job. And while there is no doubt whatsoever that Palestinians care very deeply about the potentially long-term impact of such an announcements, they simply lack the luxury of focusing the lion's share of their attention on it at this moment during this crisis. In other words, just as I said that my job at the end of the day is to provide services, care, treatment to the community to which I'm beholden, the average citizen on the street is most concerned with mundane, everyday practical responsibilities of trying to weather this storm. He or she is beholden to his or her family. COVID-19 has devastated many people's economic circumstances. Many are receiving partial salaries, if any at all, you know. And the average Joe, so to speak, is more concerned with whether his children are continuing their education and whether he can provide his family with their basic needs. Again, external political questions are simply a luxury that virtually no one can afford to prioritize over survival at the present moment. And regarding the second part of the question about the general mood, as I mentioned before, John, there had and has been mounting pressure from the community to reopen in spite of the challenges of COVID-19 in order to permit the economy to breathe again. In short, in describing the general mood, I'd probably say that both the community and the leadership have more or less agreed to accept COVID-19 as a new current reality of life. And they have decided to learn to live with it, for better or worse. So, resigned, describes the state well. However, I'd like to think that optimistic far more accurately describes the outlook than pessimistic. To be clear, our society has accepted a significant political, social, and economic paradigm shift. But should the situation worsen significantly, we are all quite certain, we are all quite sure that the government will take necessary precautions and that the public will follow suit. We just happen to be at a point now where the benefits of reopening outweigh the current risks given the rate of infections as it stands, John.
Thank you, Walid, for that very wise and articulate response. And it's not surprising that people's focus is on their families and paychecks and putting food on the table. But thank you for that. Salwa, I wanted to bring you in to the conversation. You're really you have your hand on the pulse of what's going on at St. Luke's day in and day out. Tell us about some of the present needs of the hospital. What it is that, from your perspective, you're struggling with, and what your needs are.
Still here in Nablus, we are under state of emergency in whole Palestine due to coronavirus disease. Therefore, we still are in great need for the medical supplies, disposables, medicines, and cleaning and sterilization materials to avoid spreading the disease and to keep our hospital and staff safe. On the other hand, we have a big problem and we put into consideration to continue our upgrading process for our equipment, because most of our equipment are more than 20 years old. And for sure, we could not find any spare part for any medical machine after 10 years. We can't find any spare part for replacement. That's why we are putting into consideration now to upgrade our operation theater and the X-ray department, as we are now in great need for a neurosurgical operation table, neurosurgical microscope, in addition to patient monitors for the recovery room and for the emergency unit. Our 20 years old C-arm system in the operation theater stopped working because we could not find any spare parts for its boards. And we could not be able to do advanced neurosurgeries and orthopedic surgeries without imaging on C-arm pre and post the operation. Also, our old ultrasound machine stopped working after 20 years of depreciation now. And we need an urgent 4D ultrasound, as we are transmitting now our patients to do ultrasounds out in other centers in Nablus. And also we need CR system, which is a computerized radiography system to facilitate the work at the X-ray department. We have a big problem in the laundry. We need to do replacement for the washing machines, dryers, and ironers, in addition to infrastructure of the building. We need also to have a new autoclave machine for the central sterilization department, because the existing only autoclave is under continuous maintenance, and this delayed the sterilization process for the surgical instruments. On the other hand, as far as we have the constant complaint of our patients with the disruption of their income and the inability of the Palestinian government to pay salaries to its employees, has led them to inability to pay for their treatment and their obligations of daily life. So we have lots of patients coming, knocking our doors, asking for exemptions or for partially or totally from their fees of treatment. And the less number of patients entering the hospital due to the closures affected by the badly our economic status of the hospital. And for sure, we are obliged to pay salaries for 150 employees of the hospital. And we hardly can cover our running costs and salaries to our employees.
Thank you, Salwa, for that overview. I think it will be important for us to look at that list of needs and think about a project that we might be able to generate, energy around, like we did so successfully with St. John's leadership around the ambulance. And I think when there's a real concrete project and need, people will respond. So I think that'll be a good next step for us to work with you and to identify that priority project. Could you tell us a little bit about the ambulance, how it's being used, how often it's being used, the kind of role that renovated or the brand new ambulance is playing in the life of the hospital?
As you know, in September of last year, with the direct support of the American Friends and, of course, St. John's Norwood Church, St. Luke's Hospital in Nablus was able to purchase a new ambulance, which has drastically improved our ability to provide services to our patients, and which has permitted us to essentially cope with and circumnavigate many of the challenges and outright restrictions to movement imposed by the protocols put in place in response to the COVID-19 pandemic and its impact in Nablus specifically. More specifically, during the period of strict curfews and closures imposed by the government, which I should say certainly proved fruitful in stifling the initial spread of the virus throughout the community. We were able to continue our essential duties in terms of transporting around 322 patients to and from the hospital and their places of residence between the months of March and August 2020. This ambulance also facilitated movement of staff during the delivery of patients, making work not only possible, but allowing us to overcome these obstacles almost entirely while still ensuring the general public safety. As a direct consequence of having obtained possession of this ambulance, this year proved the first time we were able to obtain a hospital license from the Ministry of Health without any difficulty whatsoever.
I think the situation getting bad all over Palestine. I mean, in Gaza Strip and in West Bank also.
Right.
You know, the curfews, the checkpoints, the closure of Israel to all West Banker, no permissions for the workers, no permissions for citizens to go for treatment in Jerusalem or in Jerusalem or otherwhere, in other hospitals there. So all breadwinners of West Banker are facing serious financial problem because they lost their means of income, especially in this pandemic situation. Since March till now, up to date, we are in a siege here in Nablus. We are in a siege. We are in a full closure. We are not allowed to go outside Nablus for work, for treatment, for anything. So this affected our patients also. For lots of our breadwinners, I mean patients, come to the hospital losing their means of income. So lots of them knocking our doors to have exemptions for their treatment, because also the Palestinian government did not pay their salaries for its employees, This affected the economic status of people towards their treatment, towards their obligations, towards their daily life. So really, all West Bankers are living under serious financial problem due to this closure and siege. And this affected badly our hospital also, because this number of patients entering our wards affected our economic situation, and this leads to a monthly deficit in our financial status also. Because as far as we are a church hospital, as far as we have a mission to serve and provide treatment to the poor and needy patients, we have to give them and provide them the good treatment, the perfect treatment, although regardless they have money or not. Because we are here to serve, not to be served, we are here to serve.
Yeah.
So thank you. I want to be respectful of time. It's getting late in the evening in Nablus, and Salwa and Walid are calling from the hospital.
John, I'm sorry for interrupting, but if I may, I'd like to add something.
Sure.
Thank you. I just want to thank you so much to all participants. Thank you, Father Sari Atik and your congregation. Thank you for taking time out of your lives to connect with the aid you are a part of providing, and for taking a tangible interest in our work here in Nablus. My gratitude is great. Overall, thank you for your charitable work. St. Luke's Hospital in Nablus looks to you and your work as a template, a model to follow. We will continue to do our best to extend your good works to our community. Perhaps once the pandemic settles and things return to some semblance of normalcy, we will be able to host you and yours here in Nablus, so that you may witness how directly your support impacts the lives of Palestinians and Nablusites. Finally, I would like to underscore our gratitude given the unique nature of this time of Corona. This is not a time in which you are supporting Palestinians because of uniquely Palestinian troubles and challenges. Indeed, I'm quite certain that each and every one of you has been touched somehow by COVID-19, and in spite of the fact that you are all similarly overcoming and learning to overcome this crisis, you are still reaching out to help others. This graciousness is not lost on us, and we thank you heartily for it. Until next time, we will be waiting to hear from you, and hopefully we can see you very soon indeed. Thank you. Thank you very much.